This is the first video I'm putting out here on the Spondy channel. And because some of what you're going to hear is going to be extemporaneous and some of it's going to be coming from a teleprompter, I want you to be a little forgiving for the parts that seem a little bit robotic. I want to begin by answering that big question that's going to set this whole program in motion. And that is, what is a spondy? Or if you like the longer name, what is a spondylolisthesis? Simply put, a spondy is a loss of alignment between any two vertebrae in the spinal column. For example, when your vertebrae are in a nice straight line, they look pretty much like this right here. But when your vertebrae get pulled out of vertical alignment, they look more like this. And this is the orientation you find in a classic spondy. As the schematic of the skeleton shows, a spondy can occur at any level along the spinal column, anywhere from the cervical area at the top to the thoracic or rib area in the middle, all the way down to the lumbar area in the bottom. And let me bring your attention to this region that's between the fifth lumbar vertebrae and the first sacral vertebrae that you run into. And and the reason I want to focus here is because this is the place where the majority of spondies take place. Now, pretty soon we're going to talk about why they attack this particular place. But for right now, let's just look in here so that you can start getting a sense of how the mechanical orientation exists between these vertebrae, so you can start seeing how the spondy is affecting you. Next, let's get this skeleton out of here, and we're going to replace it with some blocks so that you can see the spondy in a way that'll make it pretty easy for you to understand. To begin with, we're going to look at the vertebrae as though they're in a perfectly straight line, all the way from the lumbar down to the sacrum, nice straight line. Now we're going to see a change because the fourth and the fifth lumbar vertebrae, they've shifted to the left of the sacrum and toward the front end of the body. You see what I'm talking about? Yeah, this is what we call a grade 1 spondy. Now, let's do a real quick review of how the grading system operates. Imagine that a vertebrae is divided into 4 equal portions, just like this here. When we have a grade 1 spondy, the upper vertebrae is going to be moving towards the front of the body about 25% of the vertebrae. See that here? There you go. And in a grade 2 spondy, the upper vertebrae is going to move toward the front of the body by up to 50%, between 25 and 50%. A grade 3 spondy, it's going to move toward the front of the body about 75%. And then a grade 4 spondy, it's going to move between 75% and 100% toward the front end of the body. And just so that you know, the grade 1 spondy is the one that affects probably about 75% of the people, somewhere in that area. And those are the ones that are most easy to be able to manage. And when you get into the grade 2 and grade 3 and grade 4, they're a lot less frequent, but those are the ones that are more likely to need surgical intervention. They're not do it at home kind of things that you can have too much effect on. Now, all of this talking about grades, that's all just what the juxtaposition between two vertebrae are and what percentage that they're out of alignment. Next, let's talk about where the pain thing comes into this whole spondy process. You see this red line that goes all the way down from the skull all the way to the pelvis? Well, this represents something called a longitudinal ligament. Like I say, it goes all the way from the skull to the pelvis, and there's more than one of these longitudinal ligaments. I just put one to represent them. They're actually going all the way around the spine. Their job is to help keep all of the segments in the spine in place and help with some of the various movements of the back. Next, along each one of these longitudinal ligaments, we're going to find these little pain receptors. And they don't really look like this. I just put little red balls in to represent them. The the pain receptors are actually complexes of nerve fibers. Now, there's a whole bunch of different kinds of pain receptors. Some of them respond to pressure, some of them respond to temperature, some of them respond to different chemicals, and there's a whole bunch of different ones. But the ones that I want to focus on here are the ones that respond to being stretched. If you stretch them, they send a signal up to the brain that says, ouch. Now, in this schematic of the spondy, you see that the fifth lumbar vertebrae here has moved toward the front of the body by about 25%. So that would be a grade 1 spondy. And in doing so, the ligament is attached all the way along the spine. And so when the vertebrae moves toward the front of the body, it pulls this ligament out, and you see the bend in the ligament. And so when it stretches the ligament forward, what it's doing is it's actually stretching the little pain receptors on the ligament, and this sends major pains up to the brain, or excuse me, it sends signals up to the brain, and the brain interprets it as pain, and then you go, ouch. And of course, for the grade 1 spondy, the longitudinal ligament is being pulled toward the body up to 25%. When you start getting into a grade 2 spondy and the ligament gets stretched like 50% of the width of the vertebrae, then it's really being pulled. And then the pain is even more because you're stretching the stretch receptors even more, more pain. By the time you get to by the time you get to a level 4, you're in major pain all the time. Thank goodness most of the spondies are grade 1. So the purpose of this first video is to kind of let you know the very most basics of what a spondy is. In the next video, we're going to start looking at some more of the mechanics, but this is quite a bit of information already, and it's good for you to pause right here and look through this again and make sure that you have this. It's very simple information, but it's very complete as far as giving you a sense of how the spondy works and where the pain comes from. And we're going to take this to the next step in the next video. So I'm going to pause right here, and I'm going to encourage you to listen to this short video again and familiarize yourself with the different terminology. And I will see you again in the next video. I'm Dr. Wayne Baird.